We want to make sure folks have great smiles. And this morning we say hello to Dr. Judd Larson. He is over at the clinic, and you have a chance to talk a little bit about anesthesia. And this is really weird because last week we talked about this. On Thursday, I believe, was the anniversary of the first person to have a tooth extracted who received anesthetic for the dental procedure. And the first anesthetic was, do you remember, Jason?
Whiskey.
No.
No, it was the gas.
Nitrous oxide.
Yeah.
Can you imagine having that done before?
1844 is when that happened.
Yeah.
Well, obviously, there's been quite a few developments in dental practice since then, but people aren't always excited when they know they have to go to the dentist.
Absolutely, and research shows that about 35% of all people just have a fear or phobia just coming to see us. So when they walk in the door, they're already having either fear of needles, fear of probably having pain, or they've had a bad experience when they were a kid, and they carry those things over into the next their next phases. And so each dentist kind of gets to inherit those type of fears and phobias from beyond, from their past experiences. So what I actually am able to do, and I've been doing it in Oregon for about 8 years now, is we do sedation in our office, which means they're taking a combination of drugs before they come in, and then we're also monitoring just like they are at the hospital there. We have the reversal agents on hand, but it makes it so simple for these patients because basically they just sleep through the procedure, which is great. Also, the drugs also have some amnesia properties, so they don't really remember anything of the appointment. So if you think of these people that have had these bad experiences in the past, this makes it so nice. And so what a great way and what a great service we can give them to get them past those fears. And usually these people also have a lot of things going on in their mouth because they've avoided the dentist for a long time.
Sure. That's what happened for years. We had a situation growing up where we had some Novocaine that did not go away right away. I'm not sure what the problem was, but it lasted for almost a whole day. And I was terrified of dentists after that. And it was years before I went back. And then once they went back, they go, we have a lot of work to do. You're exactly right.
And we see that every day. There's tons of people that walk into our office every day with that like that, and it's so simple that we can make this happen for them. And there's certain precautions we always take, and they're, like I said, they're monitored just like they would be at the hospital, but it just makes it so simple, and they can actually just, like I said, relax, sleep through procedure. And we can do a lot of times they have many, like we said, a lot of things to do, so we can actually do half their mouth at one time and bring them back for the other half or whatever, so that way we don't have to keep bringing them back multiple visits. They can get it all done a lot in just a couple visits, which is great.
Now there's different levels of sedation, correct?
Absolutely. So basically there's 3 different levels according to the American Academy of Oral Maxillofacial Surgeons. So you have your minimal sedation, which is just nitrous oxide. You have your moderate sedation, which is what I do, which is a combination of drugs. The patient is still conscious, they can breathe on their own, but like I said, they're basically just sleeping through the procedure because it has those sedative properties.
But they're conscious though, you said?
What's that?
They're still conscious?
They are still conscious, yes.
So you can tell them to open their mouth?
Yes, I can, but they'll hear what I'm saying, but they don't care what's going on around them or what's happening.
They're in a happy place.
They're in a happy place. And then the 3rd level is IV or general anesthesia. So like if you went to the OR room, that's what would be happening there. So, and basically, I looked into IV sedation. I started taking the first classes for that, but there's so many more risks with that versus the oral conscious sedation, what we do, that I've done over 400 cases now between my experiences in the 8 years, and we've all had positive outcomes. So it's just a real simple, and there's less complications or less bad side effects for the patient.
But even needles now, you get numbing before the needle, so then the needle you don't feel nearly as much as you used to.
Absolutely, and that's what a lot of people too, some people are just harder to numb than others, and so that's what we see with the sedation, takes all that away too, because they're really relaxed, the anesthesia takes a hold. Usually when people are having a hard time getting numb.
Here, well, there's that, what do they call that, the dam, the mouth dam?
Yeah.
So kind of explain what we're seeing here, doctor.
Yeah, so basically if they're hearing the sound, they're hearing them just snoring through the procedure there. So we'd have that, I'd have patients in my other operatory. Snoring? Yeah, people, they'd be in my other operatory and you'd hear that and they'd be like, what's going on next door? And I'm like, oh, they're just having a great dental appointment.
That's just Dr. Moines. She likes
exactly, exactly. Yeah. So, but it really makes it nice, and we see that 99% of the time that's what they're doing there, and we're just able to put a tooth fellow in and go in and get their dentistry accomplished, and then they just go home, they're relaxed the rest of the day, and then they're just back to normal the next day.
Sure.
Yeah.
Wow.
That is amazing.
Yeah.
So, what first got you interested in doing this? That's my question, because dentists are a unique breed of person that be able to do this with people.
Right. Well, first got me interested. Actually, my dad and my dentist were best friends, and so he kind of got me into it. But also, I just saw so many people come into my office where they're, if I had $1 for every time I heard, "Oh, I'm afraid of needles," or "I don't like coming here," or "I don't like this." Well, this is just the perfect way that we can do that for them. Have a positive experience, and then they can come back, and they don't mind coming back. You know,
Right.
It's amazing after when they get all their problems taken care of and they're stabilized, how positive experience it can be for them, and then they're dental fanatics now. You know, like, "Oh, I don't mind coming to the dentist. This is great." And it's amazing how many people or how many word-of-mouth referrals we get from that because people have such a great experience.
Now, you wouldn't do this for every procedure, or do you? For if people are coming in for just a basic checkup, you know, and they're scared, or does it have to be more like we're going to be working in there for a while?
It's whatever their comfort level is. So we want to make sure they're comfortable and having a positive experience. So even we've done it for cleanings. We've done it for
cleanings
yeah,
too?
Yeah, absolutely. So whatever their problem is, if it's going to make it more comfortable, making them having a positive experience, that's what we want.
Now, what about expense-wise? Because I'm sure a lot of folks that are watching have to worry about expense. Now, if you have this as part of your procedure for a cleaning, is there an additional fee?
Yes, yeah, there is an additional
will insurance
fee.
pick that up or not?
Some insurance, it just depends. So, and that's what's great about the office. The girls will check into that, let them know their fees up front, so that way they know everything before we get started.
Yeah, the ladies there are absolutely incredible. And you already have a setting at Plaza Dental that's very relaxing and almost spa-like,
Yes,
which definitely
absolutely.
helps as you come in, but there's also other things you can take advantage of as well. If people want more information on this, what would be the best way to get in touch?
Best way is either to call our office at 515-224-5999 or look on our website. We're also putting more information, and we'll have more of these videos on our website too at dmsmiles.com.
All right, Dr. Judd, somebody out there is watching right now and they say, I'm still very afraid. I'm deathly afraid of the dentist. What would you tell them right now?
I would tell them just to give us a call. We'll do a free consult with them. I'll talk to them about what's going on. We'll talk through the procedures, get them all the information, and then they can make a good educated decision about moving forward.
Wonderful. That works.
Sounds good.
Thank you so
Thank
much.
you.
Very nice to meet you.
Very nice to
Thanks
meet
for
you
coming
guys.
in.
Thanks.
It is 9:22. We'll be right back. You're watching Great Day live in Des Moines.